So look, so as we enter this gray area in life, I always kind of have 40 is the gray area, the life where, you're young enough where things shouldn't happen, but it can happen. Always kind of consider that the 40s, and it kind of freaks me out a little bit, but it is what it is, So just going forward in life, what are some of those symptoms of stroke symptoms and heart disease you need to be aware about, right? Because it's all about you when you're working out and exercising. You can get short of breath, but you shouldn't be short of breath if you climb like a flight of steps and you got to stop halfway going up. There's something wrong with that, right? Chest pain, sweating profusely when you're having that chest pain, nausea, vomiting, chest pain, any of those prior symptoms that you're having with exertion. You're lifting, taking a suitcase out of the car, you're walking into the hotel, and you have to stop halfway across the parking lot because you feel short of breath or you feel that like discomfort in your chest. Yeah, that's like a warning sign. So definitely, let somebody know. And then as far as, since we're talking about heart disease, I always like to throw something in there real quick about stroke, because stroke is that other emergency type of thing that everybody needs to know about. Because if you can get to hospital soon enough, they can actually give you some medication and some treatments to reverse the stroke. Okay, so acute weakness on one side of your body, you all suddenly start slurring your speech and you haven't been drinking for the night. That's a warning sign. Vision loss. That's going to be some things there. Okay.
Let me, since you mentioned stroke, so you said that what type of feeling if you get like a numbness? I get this feeling sometimes. I cycle, and sometimes when I'm done cycling, I get a numbness feeling on the left side, sometimes the right side.
Right.
But it's not for a long time. It's just for a short period of time.
Right. So for example, so for you, I think if it was right after you were cycling, then I would probably tie it into your cycling and whatever your body position is on the bike. It's probably
were you going north or were you going south?
I mean, I mentioned it to my doctor. He was just telling me that he said that it's the position of the bike, or he asked me what size bike, and I got all those adjusted. I still get it sometimes. I think it was just he just said that, then I told him how many miles I might ride. He said, man, you might need to shorten up your miles, because I get out there and I
go
out there and I start riding.
Right. 100 miles and everything, right?
Yeah, he just told me to shorten them up. He said,
no, yeah, I agree. I mean, I think when you're in a bike, you're at a certain position and you're probably compressing some nerves either in your legs or you're sitting a certain way. And a lot of times you can get that numbness and tingling that can occur, and eventually it goes away. And if it's like that associated with exercise, that doesn't necessarily raise a red flag, an alarm symptom for me, rather than you saying you just got out your car and you're walking back inside the house and all of a sudden you just feel all this numbness and tingling out of the blue, and you're not doing anything. That's a little bit more concerning. You want to be able to explain that.
Hey, Tom, you mentioned something earlier, and I'm asking it because I know we all, well, I'm gonna say me, for instance. As men, we think, hey, well, I felt that, but like you said, I'm gonna tough this out, or it wasn't as bad as I thought. So, like earlier when you mentioned like a chest pain or discomfort, and like what can you kind of describe what that would feel like if it's just like, well, I pulled a muscle chest pain, or I'm having a heart attack chest pain, or is it cramping in my heart, or
right.
You know what I'm saying, or the discomfort, like can you describe it, I guess is what I'm trying to get at, because I know for me, I could feel something, be like, oh man, ain't nothing. And like I said, I just go on, but shoot, it could be something. You know what I mean?
Right. No, it's true. The best way I can kind of put it in terms would be if it's what I listen for when people come in the office, or if I pick it up, is can that symptom that you're complaining about be reproduced or not? Right. So if you're thinking about it's a muscle injury or a strain, in theory, we should be able to sit there and reproduce that in the office. Right. So if you've been lifting weights and bench pressing and your chest is sore and you keep pointing to the same spot, then I should be at least be able to maneuver your chest and be able to kind of push in that one area to reproduce that type of pain. And if I can't, then I kind of get worried because you are doing something stressful. I can't reproduce it, but it only happens when you exercise. So that's kind of one of those red flags that kind of pops up in mind. And then it's just a matter of going through some of those risk factors I named earlier, right? Are you somebody who's overweight? Do you smoke? Do you have a family history of heart disease? In the back of my mind, as we're sitting there talking, I'm going through that list. And the more I check off, the more I'm probably going to reroute you either back to your primary care doctor, or I'm going to say, hey, look, you need to take an aspirin every day and go see your cardiologist, or, let's get you plugged in with somebody and make sure your heart's okay. Because it does happen, Yeah, it does happen. So you just want to make sure that you can at least explain the symptoms. Heartburn is tricky because heartburn, for the most part, it sent me to a cardiologist. I had heartburn, typical. I treat heartburn every day, but I felt something funny. It was different. And I just never felt that feeling before for heartburn. And I kind of got, I felt like I'm in the 40s. You're in that gray area in life. You're in theory healthy, but things happen. So I went and I ended up getting this workup and stuff like that. It ended up being fine. But I just realized that was a different manifestation of my heartburn. And then after that, I just stopped drinking coffee so much because I realized I'm in my 40s. I don't need that anxiety throughout the day. I walk down the hallway thinking I'm going to have a heart attack in the middle of the day. So I just back away from that. So those are some of the things that you just got to be able to explain. So if you have heartburn one night and you're taking Maalox, Mylanta, Tums, and it's not going away and you can't get restful sleep at night and you have several of those risk factors and you start breaking out in the sweat, then I say go to the ER, have them sort it out, do EKG, make sure everything is okay.
What I thought about, man.
I got a question.
Real quick, Cool. I got to say something relevant to what you just said. Real quick, Cool. Okay. The thing about it is when you got insurance, right?
Yeah.
And you got some kind of chest pain or anything that's bothering you, what kind of fool would ignore the signs and just be like, I'm gonna be all right? Man, shit. All this money I paid to get a private room at the hospital, all of that. I'm gonna get checked in, bro. You know what I'm saying?
Say it again, Colby. Say it one more time.
There's no need of going home if something's going on. Go to the doctor, go to the hospital. You know what I'm saying? Because you hear stories all the time about people that say, well, yeah, we're at the grocery store and it said his chest is hurting, and then we came home, we laid down and died.
Yeah.
Not the kid. Go ahead, Cool. My bad.
Chelsea, that is an alert. If you feel bad as a black man, go to the doctor, go to the hospital. Alert, alert, alert.
Correct.
But this is my question. So first of all, thank you for being here, brother, man. It's a pleasure. We definitely appreciate it. And you put down those things about how these things affect black men. What can we do? I'm a guy to try to work out, try to eat right. So to kind of give us some things we can do that we can control to help us, mitigate some of those risks of the heart disease and things of that nature. What can we do?
Oh, what can we do? Okay. All right. Well, that kind of
I gotta live a long time, looking good, more house in the building. Come on now. We gotta live, baby.
All right,
Let me live.
All right. So
luxurious beer, you know what I'm saying?
Well, hey, but that's my goal. My goal is to give you guys some knowledge, so at least as you go through, you can work off on some of those risk factors that you have out there. So I'm gonna jump ahead and give you some of these tips and see if we could tie it to the diseases that I kind of discussed, right? So I'm gonna see if you guys can match what I'm saying as far as what you can do to which disease we threw out there. All right.
Let's do it.
And then we'll wrap things up with colon cancer and prostate cancer, because those are two big ones on the list. All right. So being active, controlling your cholesterol, eating better, managing your blood pressure, losing weight, and reducing your blood sugar. They all help prevent what? What diseases?
Diabetes.
Heart disease.
Heart disease. Diabetes, correct? Right? Heart disease, diabetes, stroke. Okay.
So I say all of them, really.
Exactly. A lot of them, right? A lot of them you just knock right out the ballpark if you can kind of do those. All right. What about stopping smoking? There's more than one answer for that. You got the obvious one.
Heart disease.
Obviously, lung cancer.
Obviously, lung cancer.
Yeah.
Heart disease.
Heart disease.
Right. Definitely heart disease, stroke as well. Okay. So the tidbits, so usually like when you smoke, some people say your heart vessels are supposed to be nice and open, but when you smoke a cigarette, for the next 30 minutes after you smoke a cigarette, your blood vessels collapse down like this and become all tight, right? So
I got a question. Now I'm not a weed smoker, so I'm just asking just for the general population.
Yeah.
What about weed? In terms of like weed smoke versus cigarette smoke.
Yeah. Well, you know what? I'm not sure there's enough data out there, yet to kind of know what are these patients who smoke weed, say, every day for the next 10 years, what are their risks of developing lung cancer to the average population? I think a lot of that lung cancer data has always been extrapolated from patients who smoke like tobacco, right? Just like lips and tongue cancers related to chewing tobacco and things. So I really don't know. I really don't know.
Well, I had heard back in the day, somebody was saying like the reason why people were using blunts versus like zigzags and roller papers was because it was the paper and the freeze-dried tobacco that was causing the lung cancer issues, not the actual tobacco leaf or like the marijuana leaf. And that's why, you know, it's better to smoke blunts with tobacco or whatever. But that was all like, you know, that was like urban legend. That's just what people were saying. I didn't see anything scientific about that. But you don't really see the same, it doesn't seem like you see the same correlation of lung cancer with weed, chronic weed smokers, because we all know some.
Right.
Versus, those people that are smoking 10 packs a day. And I'm not even sure what the equivalence is. 10 packs a day is like a sack, like a 20 sack. I'm not sure what the mathematical correlation is.
Right, correct. Yeah. And to be honest with you, I probably think we probably won't see that probably for the next 20 years. So as those chronic weed smokers get older, we'll start to see what those risk factors are, right? Because a lot of those patients that we're seeing with lung cancer today, those are the ones that have been smoking, 40s, 50s, 60s. All the way until now. So I think we'll see that with marijuana, just like we're seeing increasing patients with GI symptoms because of marijuana. I never thought that I'd be seeing patients in my office and their diagnosis is they smoke too much marijuana. They come in with nausea, vomiting, abdominal pain, and they keep coming in with nausea, vomiting, abdominal pain, and come to realize they smoke marijuana. So now you have this subset of patients where they're young, they're in their 20s, they're in your office with nausea and vomiting all the time. You rule out several other things and you realize, hey, these guys smoke weed every day. So
Tom, could you address this too? A lot of guys, play golf with, things of that nature. They think cigars are a little different than cigarettes. Could you address that as well? In the form of smoking cigars on a daily basis?
On a daily basis, I know. I mean, I still think the same things. I mean, I like a cigar myself every now and then, but the reality of it is I do know that does increase your risk. That can definitely increase your risk for tongue cancer, lip cancer, cancer within your mouth, throat and neck cancer. Depending on if you inhale, of course, anything that you inhale is going to increase your risk some more.
Right.
But again, it's one of those things that if you can minimize, great. If you can avoid them, probably even better.
But you had mentioned you had patients, or you've heard of patients come in that smoke a lot of weed and they complained about the dizziness or being nauseous or something.
Nauseous, yeah, nausea, vomiting.
The medicinal, what is that? Medicinal weed that is prescribed to you.
Yeah, I mean, those patients you really don't see. Well, those patients who are using it occasionally, you don't see them in the office. It's usually those ones that tend to do it daily. Those tend to be the ones that end up having GI symptoms that we actually will end up seeing in the office. I can't think of any patient that I've seen who may smoke weed once or twice a month where they're coming to the office with a GI complaint that I actually picked that up per se.
What's it doing to the GI tract? What's it doing to the GI tract? What's the issue?
Yeah, I'm not sure everybody knows. I think it's more or less like a central mediated effect, more so than anything else like that. I think it's a brain gut response that's kind of occurring, with that. But no, not necessarily a direct GI effect.
Yeah. Hey, Tom, you mentioned earlier, one of the things about what we can control, and one of those things was diet, right? And exercise.
Correct.
As it pertains specifically to diet, one thing you always hear, whether we're talking about these types of diseases or not, the importance of drinking water. How important is it to consume water daily for flushing your system, to keeping things on track, to just your overall health? Like, in terms of water, what, can you speak to that benefit in terms of the health and diet regime that you need?
Right. Yeah, no, I mean, I think overall drinking water has definitely several benefits, but I haven't necessarily seen any studies that say that you need 64 ounces a day or 8 glasses 5 times a day. To be honest with you, I'm kind of very rational when it comes to stuff because you'll see a lot of different things in a book, but the reality of it is that the way I kind of decide for myself if it's healthy is that one, does it decrease any health problems that you have? Is it going to help decrease prevention or prevent something? Or 3, is it going to increase your life? You know, and that can hold true for anything, vitamins and things that nature. So, you know, you really have to look at that data and kind of see if it helps, you know, but definitely trying to drinking more water would definitely allow you to kind of, you know, you feel fuller more, things that nature.
And hold on, you said in the book, you talking about your own book?
Huh?
No, he's just saying in general.
Okay. I'm like, whoa, do we miss a plug? Wait.
In general. No.
Yeah.
In general.
Yeah.
So, let's see what I want to ask you guys. All right. So here, a few more health tips for you guys, right? Let's see. What to get a PSA test? We haven't touched on this yet. Anybody know what a PSA test is and what important?
Prostate cancer.
There you go. So make sure you get that for prostate cancer. Let's see what else we got.
There are different forms of that test, though, right, Tom? Like you can actually go, I guess, get the in-office finger, you know, exam. There's a blood test to that, right? And then isn't there like a fecal test or something like that?
Well, there is. Well, there yes and no. So not for the prostate. So sometimes people kind of confuse them. So I'll clear it up for you guys real quick. So question for you, not to answer your question. I'm going to answer it, but I want to throw it back to the audience, to you guys. Where is your prostate? Do you guys know where it is?
Yeah.
Right, because it's kind of that thing that we hear about, but you really don't know where it is.
Yeah,
right?
yeah,
exactly.
What I was going through.
And KB knows where it is.
Exactly. I know, but I didn't know exactly where it was.
Had to hit you up in the gut. So get back.
Excuse me, sir. I have had my prostate exam. Thank you.
By whom?
So check this out.
Physician shit.
You know, trannies don't count.
You gotta get that way.
It's a small gland about the size of a walnut, and it's sandwiched between your bladder and your rectum, and it surrounds your urethra, right? So your urethra is that long tube that comes down from your bladder that goes to the tip of your penis. It allows you to pee, right? Urine, urethra. So the two things that go wrong with the prostate that we all got to take away from today is that, hey, you can get an enlarged prostate and you can get prostate cancer. Those are two things that are probably going to affect every one of us at some point in time if we live long enough, right? So what are some of the symptoms of enlarged prostate? You may have heard some people, your family members may have talked about this, you know, urinating more often, feeling like you have to pee urgently, or feel like you might have to pee on yourself if you don't go to the bathroom. You got to strain to pee, okay? Or when you pee, you start to dribble, right? You're like, hey, what's going on with that? Those are all symptoms of having an enlarged prostate, okay? And the treatment would be shrinking your prostate gland with medications or surgery itself, okay? And then now the big one is prostate cancer, okay? What's prostate cancer about? Well, we got to know about it because 1 in 6 men in the U.S. will be diagnosed with prostate cancer in their lifetime, right? So one of us sitting in here is going to be diagnosed with prostate cancer if we live long enough, all right? It's the second leading cause of death in cancers regarding men. African Americans have the highest rate of prostate cancer in the world. We're 50% more likely to develop it compared to white men, and we're 2.4 times more likely to die from it. But with early detection, you got 98% survival rates, okay? So remember, early detection is basically, you want to get the screening done before you have symptoms, and that's always going to be key. So what age do we screen for prostate cancer? For our age group, it's 45. All right, so your doctor should be doing a PSA on you guys every year, and they should be doing a rectal exam. A rectal exam, I do them, but the reality of it is, you know, the PSA is going to be the most important part, okay? Because you can imagine 10 doctors doing a rectal exam, trying to determine the shape and the size of the prostate. Everybody's going to have a different opinion. And then for other populations, it's age 50, okay?
Yeah, on my last physical, I go in there and, you know, I was like, it was getting toward the end, and I was like, hey, you know, I'm 48. I washed up and shit really good today. You know, are we supposed to do the, you know,
Right.
She's like, nah, dude, all we do now is blood tests. You all set. I'm like, oh, bet, cool.
Right.
Yeah.
right, because that's gonna be the most like.
I told her, I was like, man, I washed up extra and shit. I made sure I was cool for you
Make
today.
sure you clean, and you bought the wipes and everything.
Yeah.
Wow.
I figured they was gonna have the wipes, but I definitely made sure my ass was extra clean. You know what I'm saying? But she didn't go nowhere near it. I was like, all right, bet you good.
Tom.
Nah, yeah. I don't blame you. I don't blame you.
Tom, so
see, that's why I got a female Dr. Thompson there with them damn meat hooks and shit going in somebody's ass. I was like, nah, bro.
Well, you know, some folks they run when they see the size of my fingers, you know.
Look at big fingers too.
Cool on that, bro.
Tom, what is it about, or is it just genetics? Why blacks have a higher incidence of prostate cancer? Or is it something in the environment? What is it?
Well, I think genes have some role to play in it, but to be honest with you, I think it's just regular, screening and surveillance. I think genetics play a role in it. I think the reason why most people maybe die for it, or at least African Americans present later with what I call a little bit more extensive disease, is because we put stuff off. You know, so I think
we don't go to the doctor.
Right. Exactly.
And definitely don't want to put in our ass for sure.
Right. You know, that right there's a big deterrent, you know, but I think if you get people into the doctor sooner, you can get your screening test for blood pressure, cholesterol, and things of that nature, and get those things addressed, you know. So I think that's the main thing, just getting people to come in. I mean, I definitely, you know, I see it with colon cancer all the time. I think, you know, I work at 2 different offices, and one office, you know, you can kind of see the difference as far as people are coming in later for their screening colonoscopies at one office. They're coming in on time at the other office. The ones that are coming in later have more advanced disease, more colon polyps. I've seen them diagnose more colon cancer at that office. At the other office, people are coming in, their colons look good, may have a few polyps.
So basically what you're saying, one office is in Baltimore City, the other one is in Howard County somewhere.
There you go. Yeah.
Again, another alert. Go to the doctor.
Yeah.
You know what I'm saying? My thing is,
get your ass checked out.
Say it again, Colby. Say it again. That's so important.
Get your ass
Hey, Tom,
because I think all this data is kind of screwed a little bit. I mean, skewed because we're going to doctors later, right? And then we got these big numbers of African American men, you know, with these disease, because you know, because a previous generation hate to go to the doctor, but we have to be the guys get to the doctor so we get these numbers in line, because I really believe this genetics that we have, you know, extremely strong. Let's get to the doctor.
Yeah, dude, my pops didn't go get his colonoscopy for a long time. You know, he had a fucking tumor. He had a tumor. It was non-cancerous, but they had to cut it out. He had to wear a bag for like 6 months. That history made me get my first colonoscopy at 45. I go in, they go and find a couple polyps, pop them shits out. They were non-cancerous. They woke me up. It was like, yeah, you had a couple polyps. We got them. You know, looked all good. You good to go and see in 5 years. You know what I'm saying? So I got my next in January.
I was going to ask that, Tom, along the point of what Carl was just saying about the colonoscopy. Like we talked about the prostate test, but when should one start with that whole colonoscopy exam? Because I never had one. I've had the prostate exam thing, but I've never had a colonoscopy.
Okay, well then here you go. So
great question.
I'm gonna go see him tomorrow. Tomorrow,
that's my field. So you know, I'm definitely passionate about colon cancer.
I've seen Tom twice.
Right.
I started at 40.
Really?
Yeah, straight up.
Because your mom, yeah.
So
your mom's,
yeah. So in 2020, you know, a lot of us have seen what happened with Chadwick Boseman and things of that nature. You know, passed away of colon cancer at the age of 43. Now, with him, unfortunately, he was diagnosed with colon cancer at a very young age and had advanced disease, which had a low cure rate. And the screening guidelines that we have wouldn't have really caught him because of his young age. So with him, he probably had some symptoms that he brought to somebody's attention, and then he was probably had some workup and then was diagnosed that way. Now, for us, what age should you be having a colonoscopy, right? So it's the age 45. So for African Americans, should be 45. For most other groups, until recently, it was advised to have it done at 50, but recent guidelines came out to even lower for other groups down to 45. So 45, and you haven't had a colonoscopy, go ahead and go get one done. If you're afraid to get a colonoscopy, there are some other alternatives that you can do, and I'll go through those as well. But keep in mind.